role as well. Hi students, good evening. Am I audible? Fine. Okay. So we'll wait for some more time to start the session. So I'm really very much excited to be a part of this. And this is my first experience being giving a lecture in live, YouTube live. And most importantly, my favorite topic, that is research methodology. So I just wanted to introduce myself before I want to talk about research methodology. I just want to introduce about myself. Let me introduce about myself. Hope all of you are able to listen to me. What about my voice quality? Am I audible clearly? Should I use my audio headset or something? Is it clear? Because I am totally clueless. I don't know whether you are listening to me clearly. Please respond, students, so that we can start the session. Should we wait for some more students to join? Wait for another 2-3 minutes. Dear students, good evening all once again. I'm so happy and glad and really excited to talk to you regarding research methodology. Let me introduce about myself. Most of you by this time you know. I'm Dr. Balaji, working as professor and HOD, Department of Community Medicine in Tagore Medical College. I have almost 12 to 15 years of teaching experience, including my tutor period in MD Community Medicine. Almost 15 years of my teaching experience. So the way I started my research, it's really fascinating to me. Just 15 years before, I was just thinking about what I was doing in first year and second year MD thesis period. The first article of my thesis, when I started writing my first article of my thesis, I think it took 1 year for me to complete my thesis article to be converted into a research article to get it published. And for that, getting it published another year took, actually it took another year. So it's almost 1.5 years to 2 years for my first article to get published exactly in 2013, I guess. No, 2011. 2011 was my first article which got published in PubMed. First article, my first research article which got published in PubMed, that is Journal of Indian Medical Association. That is on diabetes. My topic is very much interested. I'm very much interested in diabetes. So I have done the topic in quality of care among non-diabetic patients. That was my thesis topic, which got published in 2011. So from that time onwards, from 2011 onwards, so gradually I started doing much more research and interested in research, and many students traveled with me in research wherever I worked. I worked initially in Nag Mission Karakal, then ACS Medical College, and then followed by Tagore Medical College. So my travel for the last 12 years, it was really towards research. It was really fantastic experience. So I crossed more than 100 research papers in last almost 9 to 10 years of my teaching. More than 100 research papers I published. So I've been a co-author and guide and PhD thesis, and I have done MD thesis also for many students, postgraduates, and also for undergraduates. I have trained many students in research. I've conducted more than 10 plus research workshops nationally and also our state level national conferences. I presented in many 10 plus research papers in many national and international conferences. This is in short about my research experience. So let me start about today's the topic which we are going to discuss, which is going to be first is going to be how a medical student can do a research. Is it really good for a medical student to do a research? Or what are the steps or how a medical student can proceed with the research and all those things? Because many students, they used to come and ask me very casually, sir, I want to do research. I really want to publish an article. I really want to do some research. After students, they will come and ask me, okay, ma, let us do some research. What do you know? Basically, research idea. So I know nothing about research, but I really want to do something in research. I really want to publish an article, and I really want to present a research paper in a conference, UG conference. During undergraduate period, during my MBBS period, I have never went to any of the faculty asking for, sir, I am interested in research. I really want to do a research paper. I want to present a research paper in a conference, UG conference. I have never asked for it. But I was so happy during my 10 years of my teaching experience as associate professor and professor. Many students of my undergraduate students, they came forward, sir, I want to do research. I am interested in research. How to do research? And many students, they asked me what is ICM or STS and how to publish research articles. And what are the different types of articles? This many questions they have asked many of the undergraduate students. And postgraduate students, many students, when they call me or when they come and meet me personally to help them for their thesis, they ask me two common questions. Sir, how to calculate sample size? Sir, sample size எப்படி பண்றது? எங்களுக்கு தெரியாது, sir. Please help us to calculate sample size. And the second common question, sir, please kindly help us to calculate p-value and make it significant also, so that it will be useful for us to publish in thesis. These two are the common questions asked by many postgraduates, right? So yes, a medical student has to do a research. not only in undergraduate period. I know, as you all know, as a postgraduate period during your MD period or MS period, you are definitely supposed to do a thesis. And in addition to thesis, nowadays many universities they added some more protocols and guidelines. That means you are supposed to present one research paper in a conference or one or two research papers present in national and international conferences. All those guidelines have been there for mandatory to appear for PG examination, right? So let us start with today's session. What is the aim of research? What is the basic aim of doing a research? There are four important aims of doing a research. So when you want to do a research, the first stage of doing a research is to observe the world around us, to ask questions, and why things are happening like this. So every phenomenon in the universe has a reason behind it, and the aims of research are to understand and evaluate what is happening around. So observe, describe. So by observing and describing the phenomenon, how it is happening, you can predict. So the prediction is nothing but intent of giving a statement, or the so-called, now we call it as an hypothesis. You propose an hypothesis. This may be the causative factor for this particular outcome. So you can propose an hypothesis by predicting, and then that prediction can be testable, should be testable, and the prediction can be tested by analyzing in analytical studies. Test your hypothesis by using various statistical tests and analytical methods to prove or disprove your own hypothesis. And also at the end of your research study, you explain how this entire phenomenon has happened in your particular study design. These four are the important basics of aims of research. So one is observe and describe, second is predict, third one is determine the cause, and fourth one is explain the cause, how it has happened, right? So these are the four common aims of research. So once you are very sure about or particular about the research aim, the next important thing is you are supposed to know the various steps in research process. What are the various steps in research process? How to do a research? How to do a research? Many students கேக்குறாங்க இல்லையா? The important steps in research systematically நீங்க கத்துக்கிட்டீங்கன்னா very simple to do a research. Say for example, ஒரு டாபிக் ஒரு ரிசர்ச் டாபிக் பண்ணணும் அப்படின்னா ஃபர்ஸ்ட் திங் என்ன? You have to state about that particular research problem in terms of that we call it as a research topic. நீங்க உங்க undergraduate levelல சொல்லணும்னா finding out a research topic, so which is expressed in terms of statement of a research problem. And the second step is literature review. That is, review of literature is a very important crucial step in doing any research. Literature review, or also called as ROL. ROL means review of literature. ROL is the second step. Third step, when you do some research, see, this literature review is very important. It starts from the finding of the topic, making it very clear and concise, then followed by entire research process. You need that particular literature review. Okay, this is a very important step. We will explain about each and every step in detail. Let us just complete about the research process. So second step is research review of literature. Third step is formulation of hypothesis, that is creation of your own hypothesis. Then describing in terms of your own objectives. The hypothesis will be explained in terms of objectives, and those objectives that objectives has to be implemented with certain materials and methods. The so-called materials and methods are called as study design, study area, study population, to whom you are going to do the study, that is study population. Then sample size calculation, what are the sampling methods that you are going to adapt. Then followed by data collection methods, that is using certain study tools. You will be doing collecting the data, and after collecting the data, you will be entering the data into MS Excel sheet or in some softwares like SPSS and AP-Info. So after entering data, you will be analyzing the information or data which is being entered. So after analysis, you will be testing your hypothesis with the help of your statistical tests. You will be doing chi-square test, Patty test, unpatty test, all those tests that you will be performing to prove or disprove your own hypothesis. And then finally, write the report based on your results and findings. So these are all the steps of research process. Let me just show you the slide. So I have just taken a printout just for you to understand the steps. So statement of research problem, review of literature, formulation of hypothesis. Is it readable? I think it is readable, right? And then research methods, and then selection of study instruments, data collection method, data entry and analysis, and finally the interpretation of results and writing the report. These are all called as various steps in research process. Okay, students. So, any questions in this research process? I just really want you guys to be very careful in review of literature. Let us talk about little more in detail about review of literature. What is review of literature? Anybody knows about what is review of literature? Let me tell you. So reading about the particular topic which you have chosen, in order to make your topic more clear and concise, read about similar topics which has been published in many textbooks, research articles, journal publications, magazines, textbooks, or whatever may be the source available. Read, collect all those informations, either electronic informations or from hard copies informations. Gather all those informations. This is called as review of literature. And this review of literature in this current digitalized world, there is no need for keeping any hard copies nowadays. So the best mode of review of literature is can be done by PubMed research. Please, as much as possible, avoid searching in Google. As you all know, Google is very sensitive for keywords. Better to do a literature review, especially in PubMed research and Cochrane library and any other indexed database. That is very, very important, right? So while you are doing the literature review, very important, please download the articles when you read the literature review, right? So keep the PDF document and name the document like Chinese study or Italian study or something like that, and go through the abstract alone in the beginning. Do not try to completely read the text. These are all small tips which I have learned during my experience. I'm just telling you. So please download as much PDF documents as possible and give the complete information of the articles, the authors, and everything that is important. And then read the abstract repeatedly and read about the materials and methods that they have performed. What are all the study methods that they have adapted? What is the conclusion? What is the main important result that has been given in that particular study? So collect as much information as possible through review of literature. This is very, very important. And this review of literature is going to be the long-term process, right from the choosing the topic till that time you write the discussion and publication, send your article for publication. So review of literature is very important, right? So how do you do a review of literature? This is very, very commonly asked question by many of my students. One I said by PubMed. How will you search the PubMed? So especially when you search in PubMed, you use mesh terms. Have you heard of mesh terms? MESH. MESH is nothing but medical subject headings. Use the keywords, use the mesh terms, use the author names if you know, use the journal type or journal article name or study topic. These are all the different way of searching the review of literature, right? So once you know about your own particular topic very specifically, then you state your own hypothesis. From that hypothesis, you create your own objectives and then start proceeding with the next important step, which is called as identifying the study design. So let me show an example. I'll just show an example. Hope this is also readable. If any doubts, please ask me. What is the study type? What is the study type? A case control study on smoking and lung cancer, right? Second one is, what is the research question? Research question is framed like this: Is there an association between smoking and lung cancer? That is a research question. Then research hypothesis. How an hypothesis is being framed? Look at the hypothesis. See, a null hypothesis means there is no association. What is null? Null means no. Null hypothesis means there is no difference between association between lung cancer and smoking. And next important thing is alternate hypothesis. Just opposite of null hypothesis, we call it as alternate hypothesis. And lastly, frame the research objective in terms of to determine the association between smoking and lung cancer. This is very important in terms of framing your own research hypothesis in terms of objectives. How do you frame the objectives? You are supposed to create, or you are supposed to know a mnemonic called as SMART. Have you heard of SMART? SMART. SMART. So your objectives has to be specific, measurable, relevant, and time bound. right? And attainable. A for attainable. Specific, measurable, attainable, relevant, and time bound. So when you frame the objectives, you are supposed to use certain phrases which is very specific for your objective. Like better to use to determine. To determine means that means you are trying to find out the cause. So which means when you use the phrase for framing your own objectives, it means you are indirectly quoting your own study design also. When you use the word to determine, that means you are talking about an analytical study. That means you are talking about analytical study designs, right? So let us talk about the various study designs in next step. So having formulated an hypothesis, from the hypothesis, you create 2 or 3 specific objectives with the help of the mnemonic or criteria called SMART. So I repeat the criteria once again: specific, measurable, attainable, relevant, and time bound. Okay, right? So, okay, right. We have framed the objectives. So once you have framed the objectives, next important thing is you are supposed to decide about your research study design. How do you classify various research study design? This is also a very important, crucial step. How do you classify and how do you find out your own study design for your objective? As I have told you, say for example, I am framing an objective like this: to estimate the prevalence of malnutrition in a particular village. So what is the keyword? What is the phrase that I have used? To estimate. To estimate means to calculate. So when you want to calculate the amount of burden of malnutrition, right? When you are trying to use your own word, especially in terms of creating your own objectives. After the objectives, if you want to find out your own study design, the very important thing is use the specific keyword. As I told you, SMART. SMART is nothing but specific, measurable, attainable, relevant, and time bound. Yes, another student has asked about Janish Reddy. Give us an example how to use SMART. So SMART, I have told you the criteria, right? So I'm telling you an example, right? I'm telling you an example, Janish Reddy, to describe the prevalence of, to estimate the prevalence of malnutrition in a village among under 5 children in next 2 months of my study period, right? So let us see whether all these criteria are there. Janish Reddy, let us see, right? Is it specific or not? Yes, it is. The objective is very specific because we are trying to estimate. What is that next important thing? Measurable. Is it measurable? Yes, because it is measurable. We are going to have certain criteria for measuring the malnutrition. It is measurable. Is it attainable? Yes, it is attainable. Is it relevant to the situation? Yes, it is relevant to the situation because we have included the under 5 age group as an important specific age group. And then time bound. Yes, we have created the time bound within 2 months or 3 months that we are going to do the study. So this is called as, this is how you are supposed to create the objectives using this SMART criteria. Hope Janish Reddy, you are very clear about this, for example, which I have told you. So once you have created the objective, next important thing is you are supposed to decide your study design, right? So for the study design, that is classified in terms of materials and methods. Most of the time, this is the subheading which is used, materials and methods, which I have told you, materials and methods has got 4 or 6 to 7 subheadings. Study design. What is the study design? Are we going to do a cross-section study? Are we going to do a case control study, cohort study? Most of the time for undergraduates, as a beginner, I would suggest you to do a very good cross-section study or a descriptive study, and gradually in future, after learning something from descriptive studies and cross-section studies, then gradually you can move on to next level of you are doing for case control, cohort, or any other follow-up studies, and then you can move on gradually to your clinical trials. Okay, right? So I'm not discouraging you. You learn with some basic experience, especially with basic study designs like descriptive studies and cross-section studies, right? So broadly, the study designs are classified into, as you all know, it is observational and experimental studies. So what are observational studies? The investigator just observes without doing any intervention, right? So what are experimental studies? So experimental studies are study designs which are investigator do some intervenes with some intervention so that he will try to deviate or change the course of the disease. That is called as intervention study. So observation study again is classified into 2 things which is given in the part textbook. So observation studies are divided into descriptive studies and analytical studies. So descriptive studies, we won't have any comparison group, but in Analytical studies, you will be having a comparison group, the so-called case control studies, where you will have cases and controls. So case control studies, it is also called as retrospective studies. That means going backwards from outcome to exposure. Cohort studies, as we all know, which is going forwards from exposure to outcome. And what are cross-section studies? You will be trying to find out the exposure and the outcome at the same point in time is called as cross-section studies, right? So please be careful about choosing the study design and which area and what is the study population or what is the study period. Most of the time for ICM or STS students, the time fixed for your ICM or STS means, let me just tell you what is ICM or STS. ICM or STS is nothing but short-term studentship project. It is given 2 months period for doing the data collection alone. See, the entire period of doing the research is for 6 to 8 months or 9 months. So the data collection time alone is given for 2 months period. So that is called a study period. And very important thing is sample size and sampling technique. These two are very important. Many undergraduate students, when you do a cross-section study or prevalence study, say for example, which I have told you, if you want to do estimate the prevalence of malnutrition in a particular area, how do you calculate the sample size, or how many 100 children that I have to do a data collection to do a study? This is calculated with the help of formula called as 4pq by d square. So before going to your sample size calculation, I would like to tell you the sampling methods. Are you aware of the different sampling methods? There are 2 important sampling methods. One is probability sampling method. Another one is non-probability sampling method. What is probability sampling method? Probability, as we all know, what is probability? When I'm tossing a coin, what is the probability of getting hits? Generally, what is probability? Probability is nothing but number of expected occurrence by total number of events, right? So number of expected events divided by total number of events is considered as probability, right? So it is nothing but probability sample is nothing but you are giving equal chance for all the study participants to get selected. This is important because when you are doing a systematic way of data collection, better to approach or better to do a systematic way, especially with the help of scientifically accepted probability sampling methods called simple random sampling, systematic random sampling, and stratified random sampling. What is simple random sampling? Simple random sampling, randomness itself means that it is probability, right? So what is simple random? Simple random is otherwise called as lottery method. Lottery method, that means you will be giving equal chance for all the people to get selected. The important problem with simple random is when we calculate sample size, what is the permissible error? Yeah, therefore I will be coming back to your answer. So okay, right. So when we calculate the sample size is actually important to be calculated in almost all the studies, especially when if you are doing a cross-section study, it is mandated that you are supposed to calculate the sample size because the importance of calculating a sample size is the minimum number of sample that you are supposed to reach or optimum number of sample. So anything above 300, say for example, suppose when you calculate the sample size, it's coming around 300. So anything above 300 is acceptable for doing a study for your particular sample size calculation. Right? How do you calculate sample size? Sample size is calculated with the help of formula 4pq by d square. I'll be showing you with the help of the yes, I have got it. So calculate the sample size with the help of the formula 4pq by d square. Undergraduate students, please do not worry about how this 4pq by d square formula has come. So this is mathematical calculation which has got, I need to take a separate class for that. So this is the way of n is nothing but sample. So 4pq by d square, p is nothing but prevalence. Say for example, the prevalence of a particular anemia is, in a particular area is 50%. How do you calculate sample size? So 4 into prevalence is 50, Q is nothing but 100 minus P, that is also 50, and mostly the allowable error, permissible error, so allowable error can be somewhere between 5 to 20%, better to keep it up to maximum 10%, right? So some of the textbooks says that the allowable error can be kept up to 20%. What is allowable error or permissible error? Permissible error or allowable error is nothing but when you do a sample, when you collect the data, there are high likely chances that you will also make some error. So that error, how much is acceptable, scientifically and statistically acceptable error can be fixed up to 5% to 20%. So try to fix the error as less as possible or average between 5 to 10%, but some textbooks say that you can keep your allowable error up to 20% also. So 4 into 50 into 50 by, say for example, if you want to keep the allowable error as 5%, so 5 into 5, 25, when you calculate the sample size, it will reach around 300 to something, right? So this is how you are supposed to calculate the sample size, especially when you are doing a prevalence study or cross-section study. But it is mandatory for all of you to calculate the sample size, even if you are doing a clinical trial or any other qualitative research. So better to do a sample size calculation. Okay, right? So coming back to, I hope Devraj, hope I have answered your question. So coming back to different sampling methods which I have discussed, simple random, which is called as lottery method, for which you need the entire list of the samples so that you will be choosing one person, so that you will be giving equal chance to all the people. So what is systematic sampling? So systematic sampling is nothing but every third person, every fifth person, or every kth person. How do you calculate? How do you come to a conclusion every third or every fifth? It's very simple. So systematic random sampling is nothing but total sample divided by desired sample. Say for example, the total samples is in a classroom is 150. I need only the desired sample as only 10 out of 150. How do you choose those 10 people from those 150? So total is 150 divided by the desired sample is 10. So 150 by 10, what is the number that you are getting? You are getting 15. So out of 15 numbers, you choose any one of the numbers. Okay, right? So if you choose any one of the numbers by simple random, like say for example, number 8 is coming. So 8th person will be the first person to get selected. Then add 15. Then add 15. Add 15. So likewise, when you do it systematically, finally you will be getting the 10 persons at the end of your systematic way of selecting. Let me show you with an example. With an example. This is what is called as systematic random sampling. Every third person, 1, 2, and third. Then similarly, 1, 2, and third. So every third person is being selected. This is called as systematic random sampling. And similarly, what is stratified? Strata means layer or groups, right? Say for example, in the same classroom having 50 students or something, where 20 to 25 girls and 25 boys are there. How do you choose stratified? So you divide them into two groups because already they are naturally divided as males and females. So you select 5 people from males and 5 people from females. So this is what is called as stratified random sampling methods. So these 3 are commonly for undergraduates. This is more than them. There are some more probability sampling methods are also there, like cluster sampling and also multi-stage sampling. This is all called as probability sampling. I am suggesting you students, please be careful when you do a sampling methods and also calculating the sample size. Okay, and the sample size calculation can also be done by softwares and also by statisticians can help you how to calculate the sample size. So having done the sample size and all those things, the next important thing is your study tool. Students, undergraduate students, as an undergraduate student, this is very, very important area, especially creating a questionnaire or developing a questionnaire. How do you develop a questionnaire? So what is a study tool? So study tool is nothing but an instrument which is used for collecting the data from the population. Right? So when you select the sample, say for example, after calculating the samples, it came around 300, right? So if you want to collect the information or data collection from those 300 people, how will you collect? There are 3 or 4 methods. Questionnaire method. Nowadays, most of the students they do research by Google document survey and mail questionnaire survey. All those things can also be done. So with the help of same questionnaire, you can also interview the patients personally also. That is second method. And also suppose if you want to do any other laboratory procedures, any other medical examination, any other screening procedures, all these things come under data collection method. For undergraduates, most common data collection method is a questionnaire method with interview or without interview. Or if you want to convert the questionnaire into Tamil version, most of the time it is local version of the version to be converted to the local language, which is very important when you present it to the IEC. This is very, very important, right? So when you develop a questionnaire, I will just give you some tips for developing a questionnaire. First point, when you choose a topic, try to find out is there an already existing standardized, pre-tested, validated questionnaires available in the internet source or not. If it is available, I would suggest you to better use a standardized, pre-tested, validated questionnaire provided after getting official written mail permission from the source. This is very, very important, my dear students. So after getting the permission, then you can utilize the questionnaire. Suppose if that particular questionnaire is not available or standardized questionnaire is not available, you can create your own questionnaire. Please pilot test it. What is pilot testing? Let me tell you what is pilot testing, right? So pilot testing is nothing but when you want to do a study among 300 people, before doing it with a large scale of population, do it with some 10 to 30 numbers, and usually scientifically accepted minimum number is 30. So do a pilot testing with the questionnaire in that particular population for 30 numbers or something. Modify the questionnaire according to some changes, implement the questionnaire and discuss the questionnaire with the other field experts and all those things, and then make some changes according to the local needs or something, and then implement the questionnaire, pilot test it, validate it. This processing is called as, because most of the time in study tool area, most of the time you will be writing the questionnaire used is pre-tested, pre-validated. So this is nothing but pilot testing. Once you do the pilot testing, then you can validate it and then you can use it for the large scale of population of around 300 something, right? So when you frame the questionnaire, when you develop the questionnaire, please be careful. Please always try to start with the closed-ended questions. All of you know aware about 4 important common questions, way of asking questions: closed-ended questions, open questions, matrix questions, and contingency questions, right? So 4 important questions. So better always start with, but before starting the questionnaire, give some basic information about yourself. Yes, let me read a question, one from Raghunandan. How to search for any pre-existing questionnaire, like how to exactly get them for existing articles which is in line with our requirement, right? Okay, this is not all the time, hi Raghu, this is not all the time you will be able to get the exact questionnaire which is available for your particular study. But suppose if your exact study requirement questionnaire correctly, then you can utilize some part of the questionnaire from already existing questionnaires and then modify for your own requirement also. That can also be done. So not all the time you will be getting the exact. Say for example, geriatric depression. Geriatric depression in GDS scale, it is available. It is tested, validated questionnaire is available. So if that is not possible, then you can try your own questionnaires. Please validate it with the field experts, pilot test it, and then use it for a large scale. Okay, right? So suppose for your specific topic, if you are not able to get the exact standardized questionnaire, that suppose if you are able to get some part and parcel of the questions, those questions can be utilized for your question also, but you are supposed to definitely give the source of the question from which you have downloaded the questions, right? Hope I have answered the questions, your question, Raghu. Any other doubts regarding the questionnaire? So please, 4 questions are there: closed questions, open question, matrix question, and then contingency questions, right? Very important thing. How do you give the choices? Do you all know about Likert scale? What is Likert scale? Likert scale is nothing but it is a continuum of answers given, like strongly agree, neutral, disagree, strongly disagree. This is how it is commonly used as called as Likert scale. Usually it is called as 3-point scale, 5-point scale, or 7-point scales are there. So better you can use 3-point or 4-point scales. Dhyanish Reddy has asked one more: if you take questionnaire directly, will it be counted as plagiarism, sir? Yes, you can never use a questionnaire without getting any official written permission or mail permission. You cannot use anybody's questionnaire without any permission. This is very, very important, right? Okay, right? What is face validation? Devraj has asked me a very important question, face validation, which is a little bit beyond our questionnaire, but still there are 4 types of validity: criterion validity, content validity, face validity, and one more validity is there. So there are three or four validation of questionnaires are there. So in that, face validation is nothing but it's almost similar to content validation. So content validation is nothing but when you create some content in your questionnaire, give this particular, say for example, if you are creating a questionnaire for depression, new questions. So check whether the questionnaire has got all the contents which are able to get the points in relation to depression. That is called as content validation. And similarly, what is criterion validation? Criterion validity is nothing but those points, whatever that you have, questions that you have taken in relation to depression, that should have the criteria for diagnosing depression or should have a screening criteria for depression. And similarly, face validation is nothing but getting the final opinion or expert opinion from the psychiatrist or psychologist regarding the content and also the criterion validity. All those things are considered as face validation. Okay, right? So next important one. How should we frame a questionnaire, sir, with respect to relevant to the subject and the study? How should we, yeah, for that framing a questionnaire with respect to relevant to the study subject, you are supposed to do literature review as much as possible. Do literature review, find out the results and find out the answers or find out the materials and methods and results published in that particular similar topic which you have chosen, which already published it. Other than the questions, you can choose one or two questions the way that they have published in their results. Otherwise, you can choose some of the questions. You can validate it in future for your research. So in that way also it can be done. I have done many studies like that way. It is not stealing their scientific content. It is finding out how they have presented their own way of results. So from those results or from those findings, you can frame your own questions for your own study topic and create your own comprehensive questionnaire also. That can be done. Hope I have answered your question, Revan. How should we frame a questionnaire, sir, with respect to relevance to the subject and the study? Okay, right? Is that clear, Revan? So the creation of questionnaire and making a questionnaire, validating the questionnaire, pilot testing the questionnaire, all these things are very, 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 very important, right? Because in the study tool based on because you have got two important study outcomes, especially internal validity and external validity. What is internal validity? Have you heard of internal validity? Apart from this criteria validation, face validation, these validations are all related to your. These validations are all related to your questionnaire. What I am asking is your research topic or your research has got two important validations. One is internal validity, another thing is external validity, right? So internal validity is nothing but you are supposed to measure or you are supposed to exactly, accurately collect the information, what it is supposed to measure or what it is supposed to be collected. That is called as internal validity. That's why you are supposed to do this pilot testing and your validation of your questionnaire. So that is called as internal validity. And once you have done this data collection of a particular sample, this particular sample findings you are going to extrapolate to the general population or population from which it is drawn. That is called as external validation. So your making of the questionnaire and utilization of study tool has got a very, very important place. So which will decide your both internal validity and your external validity. So once you are sure about your study tool, then you enter into the important area called data collection method. That is called as various data collection methods called interview and all those things, interview method, laboratory diagnosis and all those things, right? Yes. Next important thing is, let us just talk about briefly about some basics about statistical test. Once you have collected the data, please be careful when you are entering the data into the MS Excel sheet or your SPSS software or your EpiInfo software. I would rather suggest all of our undergraduate students to enter the data into the MS Excel sheet rather than going into the software, jumping into the software immediately. So first enter the data into the MS Excel sheet. Please be careful when you are what columns that you are creating, what rows that you are creating. So these are all the coding system. If you are creating any codings or whatever the codings that you are creating, so please have a master table and then try to enter the data into the MS Excel sheet. So then that entered Excel sheet data can be utilized for your analysis and in SPSS software or any other software for getting your analysis, right? So yes, analytical part. What are the types of data that you know? When you want to go into the analytical part, the so-called, especially the analytical part, you will be testing the hypothesis. Have you heard of the word test of significance? Many students would have heard test of significance. What is test of significance? Do you know? Test of significance is nothing but statistical tests done to identify or done to find out whether your hypothesis or prove or disprove your hypothesis. You collect the information and that information is being analyzed as a statistical test. So those tests are called as tests of significance and you will be finding out the p-value, that is called as probability value. The probability value is nothing but less than 0.05 and more than 0.05. That is a cutoff given for, scientifically given cutoff for 5%. So 0.05, less than 0.05 is significant, more than 0.05 is not significant. So what are the basic scientific statistical tests that you know? This is the tabular column which gives you the classification between parametric test and non-parametric test. What is metry? Metry means measurement. So if the data is measurable, then the type of data is called as quantitative data. If the data is not measurable, then the data is called as qualitative data. What are the examples for qualitative data? Qualitative data, the color of the skin and gender, color of the hair, these are all coming under qualitative data. What is quantitative data? Quantitative data is any data which are easily measurable. Say for example, age, blood cholesterol level, hemoglobin level, all these things come under measurable data, which is called as quantitative data, right? So you are supposed to know when you present the data, when you want to analyze the data, before analyzing the data, you should know that what type of data that you are dealing with. That means, am I dealing with the qualitative data or a quantitative data? If you are dealing with the quantitative data, go for parametric test. If you are dealing with the qualitative data, go for non-parametric test. The most common non-parametric test is chi-square test, and the most common parametric test which is commonly used for students are unpaired t-test and paired t-test, right? So let me just repeat it here. So look at this type of data is quantitative, here it is qualitative, right? So if it is quantitative, it is expressed in terms of mean and standard deviation. And if it is qualitative, it is expressed in terms of percentage. And look at the types of tests. Unpaired t-test, paired t-test, and now it is most commonly done test for parametric test. And unpaired t-test, most common test is chi-square test, and also some more tests are there, McNemo's and Fisher exact test. So know some basic statistical test, that is more than enough. Of course, instead of performing the test in the software, I expect you guys to know how to interpret this statistical test inference with the help of p-value. Navanithan is asking a question, sir. Is it more credible for a study to gather quantitative responses / data than qualitative responses? Is it more credible for a study to gather? No. See, credibility for a data is not dependent on whether it is a type of, it is not dependent on your type of data. Navanithan. So it is nothing but if whatever the study, your research topic demands, if you are dealing with the quantitative data, you can present it in quantitative only. Okay, right? So there is no question. See, the credibility of data mainly depends on how you collect the data. How far your data is credible is nothing but how you are able to collect the data basically from the study sample. That is more important rather than credibility talking about the difference between qualitative and quantitative. Okay, right? If your study topic is qualitative, say for example, I want to do a qualitative study among, say for example, I want to do an opinion-based study among how this internet-based or especially the digital-based teaching, how it improves the learning experience among students. So opinion can be obtained in terms of qualitative aspects only. So that is called as qualitative research. So qualitative research demands only the qualitative data. So the qualitative research opinion can be applied by one-to-one interview, which is called as face-to-face interview with the interview guide, and the entire interview will be recorded, or it can also be done by this digital interview also, by WhatsApp interview or any other Skype interview can also be done. So this is called as face-to-face interview can also be done, and focus group discussions. These are all the different methods of data collection for qualitative methods. And similarly for quantitative, if you want to measure blood cholesterol level and versus the drug, whatever that you are giving, how it reduces the blood cholesterol level. This is typical quantitative data, right? So credibility is not based on whether the data is qualitative or quantitative. Credibility is mainly depends on how you collect the data, how your questionnaire is standardized and pre-tested or pre-validated, and your data can be a qualitative data or quantitative data based on your research topic and your data collection method. Okay. And Dhyanesh Reddy, can you explain more about those tests? Yes. What tests that you want, Dhyanesh? Tell me. Do you want more about chi-square test? Do you want more about unparty test, party test? Let me tell you with an example, right? So for Dhyanesh Reddy, look at this table, right? So before choosing a test, before choosing a particular test, look at this. See, if we have two independent variables, two related variables, more than two groups. Let us talk about only the two groups, okay, right? If your data is qualitative, absolutely you will be going for chi-square test. If your data is quantitative, especially if the group is two independent variables, then you will be going for student t-test, especially the unpaired test. Here, if the groups are related groups, then you will be going for paired t-test. I will explain you with an example, right? That is an example here. Yes, students, read this question number 1. What is this question? While testing an hypolipidemic drug, serum lipid levels were tested both before and after its use in an experimental study. Which statistical test is best suited for the statistical analysis of the result? Right? You are doing an experimental study to test the hypolipidemic effect of a particular drug before and after giving the drug. So, what will be the statistical test? So, when you want to choose the test, I am taking especially for Dhyanesh, please listen. When you want to choose a particular statistical test, you are supposed to answer 3 questions. First question is how many groups? What type of test? Is it visible? Read only the question number 1. We will discuss about the question number 2 later. This is very important and interesting aspect. Read only the question number 1. Yes. Hope all of you have read the question number 1. Okay. Let us discuss about the question number 1. Okay. Let us discuss about the question number 1. So what they have done in this study? They have done an experimental study to find out the effect of a drug given before and after, and especially in reducing the lipid. Sir, Sujit, if I am to use laboratory report for quantitative analysis, can we rely on patients' reports taken from different labs? Absolutely no. It is not possible to rely only on patient reports all the time. But if there are no other reports available, Sujit, then at least we can use the patient reports available, not from the patient words, right? Suppose if the patient says that, sir, my blood sugar value is this much in last 2 months back. No, you cannot rely on patient words. You can use the patient reports, but that is also not commonly practiced. Better if you want to do a study as an experimental study, you do the report on your own and find out what is the outcome. That becomes more evidence based rather than using a lab report from the patient. Okay, right? Okay, I'll just show you a slide once again. Read the question number 1 alone. Question number 1 alone. Okay, question number 1 says that an experimental study was done to find out the effect of hypolipidemia among groups, especially before and after. Okay, it says that both before and after its use. Okay, right? 1 second, my dear students. I'll just take that page. That page will give you. Yes, look at this. So when you want to choose a statistical test, you are supposed to answer 3 questions. One is type of data, which type of data that you are dealing with, and the second one is how many groups, then whether the groups are dependent or independent. Okay, right? Now, tell me, with the help of this, what is your inference about question number 1? Is it, I'll give you a choice. Is it a chi-square test? Is it a paired t-test? Is it an unpaired t-test? Is it an ANOVA? It is a paired t-test according to the, sorry, once again. See, according to this, look at this. This is drug is given before and after, and you are checking the level of the lipid levels before and after, right? So before and after means it is done in the same group, which means they are related groups, and the data is measurable data, which is quantitative. When then you will be going for parity test, right? So this is question number 1. Let us see the question number 2. Are you clear with the question number 1? Now let us see the question number 2. What is the question number 2? Mean bone density. Please read that question. Please read that question carefully. A mean bone density among two groups of 50 people is compared with each other. The test of significance used will be, right? So you are comparing the mean bone density among two groups. That's all. So mean bone density. If the data is being calculated in terms of mean, that means you are dealing with quantitative data, and the group said it is two groups. So two groups means you have got two choices. Either it is an unparity test or it is a parity test, right? Is it an unparity test or parity test? It is an unparity test because they are two different groups. This is how you are supposed to come to a conclusion that what statistical test that I will be performing for my testing of our own, my hypothesis based on my own objective. So everything is linked, students. So framing a research question, based on a research question, you will be framing an objective and your hypothesis. And the hypothesis get the data collection. So and the data collection get the analysis. So it is linked, it is a thread. You cannot do whatever. So you want the question to be shown once again. So mean bone density is compared with two groups, right? So as I have told you, mean means quantitative data. Bone density, it is nothing but mean is only, it is quantitative data. Okay, two groups, different groups. So it is going in for unparity test, right? So let us see the question number 3. Read the question number 3. I'll give more time for you guys to read the question number 3. See, this would have been very easy if I would have presented with PowerPoint. அது இன்னும் நல்லா இருந்திருக்கும், ரொம்ப இன்ட்ரெஸ்டிங்கா இருந்திருக்கும். Is it sufficient time? Read the question number 3 alone. I will show you the question number 4 later. Read the question number 3. Because we are supposed to complete our how to publish a research article. That is also a very important aspect. So after this statistical portion, we will be discussing about that. Which one, Revan? Is it question number 3 or question number 4? Revan John, is it question number 3 or question number 4? So question number 3, for testing the statistical significance of difference in heights of school children among 3 socioeconomic groups. See what you are testing. What is your outcome? Height. So height is a measurable data or non-measurable data? It is a measurable data. That means we are dealing with a quantitative data. Quantitative data na test, parametric test. Okay, right? So parametric test la எத்தனை group இருக்காங்க? It is clearly say that it is 3 socioeconomic groups. So 3 socioeconomic groups அப்படினும்போது automatically it goes to not unparity test. It is ANOVA. Revan, am I clear? Am I clear? I just repeat it once again. Look at this. Quantitative data, more than 2 groups, go for ANOVA. Okay, right? So is that clear? Revan here. So let us see the question number 4. Read the question number 4, guys. A study was conducted to test if use of herbal tea. I just read it once again. Yes, one second. One person was asking the question: can first and second year students do any kind of basic research, like making a survey for finding out how many common people do self-medication and what they think about for analysis and public? Yes, absolutely, Arun. Absolutely. Basic survey questionnaires also can be done. Only thing is, Arun, you are supposed to standardize the questionnaire. Pilot test it, clear questionnaire, expert nalla kaatunga, nalla expert the quantitative validation process lam pannittu. You can do any survey, first year, second year, anybody can do research. Anybody can do. This is what I am telling you as medical students. Right from the first year or second year, do some basic cross-section study designs or cross-section surveys பண்ணுங்க. that will give you a lot of satisfaction. Okay, my result has given this outcome. I'll be happier. You can do research. Arun. Hope I have answered the question for you, Arun. So let me just read the question number 4. Students, all of you read the question number 4. This is little bigger, but I read the question. Please listen. A study was conducted to test if use of herbal tea played any role in prevention of common cold. Okay, right? So use of herbal tea. Please explain how meta-analysis is important about it. Sorry, meta-analysis can be explained little later. I will definitely make a note of it. Arvind, I will tell you meta-analysis and systematic review. That is also there. That is also important study design, which I will tell you little later. Let me just complete this example. Okay, Arvind. So a study was conducted to test if use of herbal tea played any role in prevention of common cold. So data was collected on the number of people who developed the cold and not. So who developed cold and not, it is nothing but a qualitative data, developed or not. So developed or not, the outcome yes or no. Yes or no outcome, it is nothing but the qualitative data. So how many groups? Only 2 groups. So 2 groups, it is chi-square test. Okay, right? So this is how you are supposed to come to a conclusion with the help of 3 important questions. I repeat this, students, this is important for you guys. So find out what type of data that you are dealing with. Find out how many groups are there and find out whether the groups are dependent or independent, right? If you answer these 3 questions, then you can very well find out you are going to perform chi-square test, unpaired test, paired test, or ANOVA, right? So let me just come to a question of Mr. Arvind. Please explain about meta-analysis and the importance about it, sir. Yes, meta-analysis, Arvind, I would like you to know a little more about systematic review rather than meta-analysis. Of course, for undergraduates, both are same only. What would be reliable topics of first and second years to say? Reliable topics, Arvind, Anjali, nothing you can say that reliable topics for first and second year, reliable. You can choose your own topic based on your own feasibility of data collection and your guide, right? So nothing you can say that first year, second year, this is reliable, this is not reliable. It is not like a water rate compartment, right? So let me explain to Mr. Arvind about systematic review and meta-analysis. So systematic review is nothing but scientific and systematic way of getting the information from the already published sources, from already published research articles. The information is entire article you convert into your own article and then write it in a very large number of words, like 400 words and 4,000 to 5,000 words. That is called a systematic review, which is also called as meta-analysis. Meta-analysis is nothing but analysis of analysis. We use the word analysis of analysis. That means to get the official permission from the publisher, those who publish the data, get the informations related to your topic. Suppose if some 10-15 studies you want to collect. So collect the information from all those 10-15 studies. Only thing is, all those 10 to 15 studies may or may not be in your own study design. Say for example, you want to prove the hypothesis like smoking causes lung cancer hypothesis. You want to prove and you want to write a systematic review. I'm answering the question for Mr. Arvind. Okay, right? So you want to do a hypothesis testing for smoking causes lung cancer. As you study panla, you want to collect the data from some 15 to 20 articles. Some 15 to 20 articles, and 5 studies would have been a cross-section study, or 5 studies would have been an experimental study, or 5 studies would have been an analytical study, or some other cohort study or something, right? So every study has its own advantages and disadvantages, limitations, biases. So when you do a systematic review, get official permission from all the published authors and also from journals, and get those data and start writing the systematic review after completely going into the article, going into the already published article. So it's a number may vary, 10 to 20, it can be more than 30, it can be 40 or whatever may be the published articles. From those published articles, get the official, because there are some criteria. Systematic review criteria, especially for consort criteria. Prisma criteria. There are lot more criteria. Consort for reporting trials, and similarly for STAR. STAR is a criteria for diagnostic accuracy, and similarly for Prisma is for criteria checklist for publishing systematic review. So these are all the guidelines given for how to publish a systematic review. Go through all these things, then you can easily find out how to find out a systematic, how to write a systematic review. It is not so difficult, but you need lot of time to go into each and every published article, every published textbook content or any other source. Go into deep into your particular topic and then start writing the systematic review. I can definitely guide you for writing the systematic review, which is a very interesting, actually very interesting point, especially during this COVID time. You can take out publish the COVID articles on particular topic that you want to publish, and the particular topic you can choose some 15 to 20 articles, publish an article. You can write your own systematic review. I think I hope I have answered Arvind question. Next question: what is your advice or suggestion to undergraduates like us for the selection of topics? No, selection of topics, Mr. Raghu. I think selection of topics on the advice now. First, assess your data collection source or data collection feasibility partner, because research you cannot afford to lose your regular academics. Many of the students, they come and say that for interest finally they find it so difficult to take both research, academics, extracurricular activities, all those things. It becomes very difficult. So find out the data, easy data source, one thing, and find out your feasibility of your data collection. These two is more than enough for selection of topics, Raghu. And Sujit has asked one question: should we get permission for using other results, or should we can just credit them? Should we get permission for using others' results? Yeah, when you use other results to be quoted in your study, you should quote their references. That is called as citations. You are supposed to give the citation for the reference or the quoted content that you are getting it from some other source. So the credit that is very, very important, right? Whatever may be. See, do you guys know what is plagiarism? This is all coming in further discussions. Do you know what is plagiarism? So if you do not cite the reference source, then it becomes scientific theft, or it is called as plagiarism. Please be very careful. Even the grammatical content also, not only stealing the numbers, right? So even grammatical content, same content, cut, copy, paste, language, cut, copy, paste is called as plagiarism. Please avoid doing this plagiarism. You are supposed to give the credit to the person or author who has published the article, right? So I hope I have answered Sujit's question also. And Arvind, is institutional ethical committee necessary for meta-analysis? Absolutely, Arvind. For any research study, you need an IEC clearance, which is Institutional Ethical Committee, or some other places you will be having IRB, Institutional Research Board or Review Board, right? So you have to get the IEC clearance for doing any study, not only for meta-analysis or systematic review or whatever. You are supposed to send your proposals to your IEC team. Okay, Arvind? Sujit, in our studies, my question, I think you are not able to get your question clearly, Sujit. Arvind is asking, is doing meta-analysis worth? Yes, absolutely, Arvind. Why you are asking this question? There is no doubt about asking this doubt at all. It is definitely worth. See, do you know, currently 3 years, 1 or 2 years back, meta-analysis systematic review was not commonly used article, one of the type of article for getting promotions in medical colleges. Now, systematic reviews, meta-analysis, original research articles, all these three are used for, all these things can be utilized for getting promotion, provided if it is getting published in a indexed, especially PubMed index, Scopus indexed, and PubMed Central, Web of Science, some indexing agencies. Indexing agencies are nothing but electronic databases where your journal article is being available electronically by the readers can utilize it for reading it. So those databases are called as indexing agencies or indexings, right? Sir, I am out of college now. How can I do data collection as I can't get ethical committee now? Yes. No, many colleges, they do ethical committee. This is for, I can't understand the name. But yes, you can get the institutional ethical committee permission by See, in many colleges, they started doing IEC by virtual platform. Many colleges, they have started doing in virtual platform because this is a very unnatural situation. Nobody is expected such a situation. So for that, there is no need for postponing your research or research interest. So if there is availability of virtual platform in performing your IEC proposals, presentations, that can be done. You can get it. You can thing you can find out from your institute only. Is ethical committee clearance is needed for a surgery type of study? Absolutely. That just now I said, Anuradha, for any studies, undergraduates, please be careful, be clear. You need a IEC clearance. There is no doubt about it. IEC clearance illama, please do not do any studies. I strongly suggest you to get IEC proposal presentation clearance do a study. Okay, right? Pavitra has asked, what kind of research topics can be taken into consideration during this quarantine period, sir? Kind of research projects, if you want to do a project, I would suggest you one or two topics. This can be discussed actually personally rather than in this platform, but I can tell you one or two topics, maybe virtual learning studies pannalam, COVID pathina KAP studies pannalam, COVID, especially COVID, how they are coping, what are the psychological mechanisms that they are adapting, defense mechanisms that they are adapting for coming across this COVID situations, economic problems faced by people. Many topics are there that you can do at this particular quarantine period. Pavitra, Arvind has asked one more question: how to find whether a journal is indexed or not? Yes, go to the journal page. Go to the journal page. And the knowledge heading about the journal. Indexing, citing for the authors and so do a knowledge link. So there you touch the link and find out, scroll down and go through the indexing agencies which is given in that should be published publicly in the journal page. Okay, right? Or any other electronic web page or any other database available in the journal where that indexing agencies has to be publicly proposed in the first page itself, first page or second page, or it will be available in the about the journal. Kandipa, it should be given. Okay, right? So find out. Okay, how to find out whether a journal is indexed or not. So this is the way you are supposed to find out, right? Aravind has asked one more question: how to find whether a journal is indexed or not? Okay, then Dhyanesh, if we copy information from meta-analysis, is it enough to cite meta-analysis or we need to cite original author? Yes, you are supposed to cite both the people. You are supposed to cite the meta-analysis. For that, you are supposed to get the written permission. That author name also should be quoted and cited, and also we need to cite the original author also. Both the things has to be done clearly. Okay, right? Arvind, for cadaveric study, many not getting IEC approval, sir. See, for cadaveric study, many not getting IEC approval is not good, but still you can get IEC exemption. IEC exemption or criteria, but IEC exemption also should be signed by the IEC coordinator. Okay, right? So that is also should be done, but IEC exemption or certificate that should be obtained from your institutional ethical committee. Okay, right? I did a Google survey regarding COVID-19, even posted it in the forum of WHO and gained good response. But I did all these without ethical committee clearance. Will that be a problem, sir? Yes, in future, the quote it will become a problem. But be careful, students. Whenever you do even a simple survey or questionnaire-based survey, whatever that you do, better you do it with a IEC clearance or even with AIIMS IEC exempted clearance, no study IRB clearance, or with your deep permission. You get an official permission from the head of the institute. But better I would suggest you not to do any study without getting any IEC clearance or IEC exemption letter. Okay, right? So how to get published? So how to write an article? What are the portions? What are the parts of a research paper? Hope all of you know this. These are the different parts of research paper. Start from abstract, then introduction about your particular topic. This is called a top-down approach, narrow-down approach. So start from broader concept and then narrow down to your justification of your topic. Okay. Then your aims and objectives, then materials and methods, results, discussion, conclusion, and then your reference list. Right? Can you please give some example of free indexed journals? Free indexed journals. So what do you mean by free indexed journals? See, indexed journals, go through your Google search la poitu type your specialty journal. Okay, suppose you want to, if your topic is related to microbiology, if your article is related to your anatomy or any other thing, right? So go to this particular specialty journal name portal, get the journalist name. Okay, right? This is the first point I'm telling Arvind. So first point is to find out the different journals, right? Then அந்த ஜேர்னல் குள்ளார வெப்சைட் பேஜ் குள்ளார போயிட்டு then you find out whether is this journal is a index journal or free index எல்லாம் எதுவும் கிடையாது. Any journal is indexed. So I think your question is free to publish னு கேட்க வரீங்கன்னு நினைக்கிறேன் அரவிந்த். Am I correct அரவிந்த்? Free to publish கேக்குறீங்களா இல்ல free index journal? Free indexation எதுவும் கிடையாது. So free to publish without any publication charges. So many journals are there without any publication charges that you are only supposed to identify based on your article, study topic and study article or specialization. Say for if you want to do a study in microbiology journals என்னன்னு பார்க்கலாம். For this, I will suggest you to find out from UGC care list. போங்க போயிட்டு without publication fees அதான் நான் சொல்ல வந்தேன், right? So I hope what you tried to say is correct. So without publication fees is also many journals are there, but you are supposed to find out. It takes a lot of time. So just like that நீங்க கேட்டீங்கன்னா I cannot just like that tell you the without publication fees இருக்கிற journal ஜெனரலா கேட்க முடியாது. என்ன ஸ்பெஷாலிட்டி, என்ன டாபிக், for that particular topic is there any free journals are available without any publication fees that we need to find out after going through extensive search. Okay, right? Am I okay with Arvind? I think I have answered correctly for Arvind, right? Pavitra has asked a question. Where else can we post our research papers other than IMCR, ICMR? Where else can we post our research papers? You can post. Post means I don't understand. Post means you mean to say you want to publish it. See, your articles can be published. Your articles can be published based on, I'm telling you reason, just now I told you, your articles can be published based on your research topic, which specialty, and also ICMR, STS is one of the ICMR ni publish பண்ண முடியாது. ICMR is having a journal which is called as IJMR. IJMR is the Indian Journal of Medical Research. ICMR is our central nodal research agency which is conducting a short-term studentship program for promoting research among undergraduate medical students. That is separate issue. ICMR, okay, right? ICMR is running a journal called IJMR, that is Indian Journal of Medical Research. In that journal you can publish. Okay, Pavitra, hope I'm correct. Hope I've answered your question. Sujit, if we are not affiliated with any institution, how can we get clearance? If you are not affiliated to any of the institute, then you can approach the nearby or any of your institutes nearby in a any medical college. Medical college will be having their own IEC. You can have affiliation, so you can get the IEC clearance through that affiliated medical college. Okay, right? Or you can also approach through universities or any other organizations. Also, they are also having NIE. So, for example, National Institute of Epidemiology, they have got their own IEC. And similarly, where I'm working as a in the medical college, we also have our own IEC. So we also undertake the articles which is being proposed from outside also. So we can also approach any other medical college or institute. Okay, right? UGC list, UGC care list, UGC University Grant Commission -CARE. Okay, right? So find out that using Google search UGC care list and type panina, you can easily find out the journal list which is available, indexed journal, quality journal with good impact factor. Everything is clearly given, so that you can choose those journal. But and the journal the publication fees irukka illaiyangiradhu and the journal web page ku da you are supposed to find out. Okay, right? How large, Arun has asked the question, how large should a data collection be or to get a good idea of what we have surveyed, to get a complete picture of publisher research? So how large the data collection are, you need to say, I think you are asking about sample size. So how large or how less is the sample size? How optimal the sample size can be decided based on your previous studies data are based on using a 4pq by d square formula. You can calculate the optimal sample on which you can do the sample size, sample data collection. Okay, say for example, 4p reduced to a formula, calculate you have got 300 sample. So anything above 300 that you can do, but the minimum sample size or optimal sample size for doing a particular study, this is for example I am telling. So this is not 300 is not the permanent criteria. Okay, right? Hope I have answered Mr. Arun also. The next Arvind, please explain about publishing an abstract and hypothesis in a journal. Is it worth? Please explain about publishing an abstract. See, abstract has got 5 to 6 components. So 300 words. Any abstract in a journal, in order to get published, it should have some 250 words to 300 words, Arvind. Okay, right? So that is also based on that particular journal, right? So how to get it published? I'll tell you some important important key things that how you are supposed to publish in a journal with the help of these subheadings, right? Abstract. What is an abstract? Abstract is nothing but for 250 to 300 words or entire published article gist. This is what we call as a summary, right? That should include background, your objective in 1 or 2 sentences, objective in 1 sentence, then followed by materials and methods. What are the important results that you have obtained in your result, and what is your conclusion based on your result, right? So these entire abstract should have 250 to 300 words. Clear upon no. Either you prove or disprove your hypothesis. Don't worry. Please publish your article, right? So publish பண்ணிட்டு எனக்கு statistical significance வரல, எனக்கு p value less than 0.05 வரல, அதனால நான் publish பண்ணல. Please don't ever rely on this p value. So p value is important, but p value significant வரலங்கிறதுக்காக publish பண்ண விடாதீங்க. You have to publish the articles. Okay, right? Hope I answered. Arvind, please explain about publishing an abstract. This is how you are supposed to send your abstract. Many UG conferences, you have got a lot of open opportunities. You can present in a lot of conferences, CMEs, seminars. Many things are there for you guys. So send your abstract, and then once your abstract is getting accepted, then you can prepare the PowerPoint, and full text can be converted into the PowerPoint, and then you present it and then publish it. Okay, right? I have read a few journals where abstract is explained in an interesting way, sir. Can I use some basic history and interesting facts in my abstract apart from the necessary components of abstract? Yeah, you can use some basic interesting facts. That can be done, but better to be used in background portion. Okay, Sujit. So that background, whatever that basic history and interesting facts, and the interesting facts, it should be there only in the background, especially in your abstract. Okay, right? So after your background presentation and introduction, then you can present about your objectives, then materials and methods, results and conclusion. In the objectives portion, in the conclusion portion, you cannot use any history or facts, but these histories and facts can be used in the full text article, especially in discussion portion. Okay, Sujit, am I clear? So a good introduction. When you write an introduction, parts of research paper, when you write an introduction, a good introduction generally consists of 3 distinct parts. A general presentation of a research problem, then the layout, exactly what you are trying to achieve in this particular study, then start your own position, then proceed with your objectives, right? So then, Revan, are there any research activities where the students do not need a guide, sir? Anything which the students can do independently? Please, I would never suggest you to do any study independently as long as you are studying in an academic institute. Okay, right? You should definitely have a guide. Guide is ரொம்ப advantage பசங்களா. எதா இருந்தாலும் நாளைக்கு futureல guide definitely can take over the responsibility than the students. So please avoid doing a research independently. That is not acceptable. I would never suggest you for my undergraduate students. Even for postgraduates also, I would suggest, see, PGs are, it's better because they have registered medical practitioners, they are doing MDs, MS, so they can do independently. But still, there will be a guide for even for thesis in postgraduates, right? So please do not try to do any studies without guide. Okay, right? So some more words that you are supposed to know. I think all of you are aware about. Do you know about what is impact factor? Do you know about citation? I think we have discussed about plagiarism, indexing, index section, and the citation, and then pathachi. So when you get an information from some other source, please give credit to the author. That is called a citation. Okay, right? So index journals can be from any of the database like PubMed, Scopus, Google Scholar, Elsevier. So better to get index journals always carry a little better quality than non-index journals. So always try to publish in index journals rather than in non-index journals, because index journals are scientifically qualified put out. Okay, right? So when those articles are being read by any of the scientifically researchers or research articles can be used for or utilized for as a resource or as a reference by any other articles. Similarly, for my articles, 100 plus articles which I have published, I have told you in my introduction, yeah, my so far. So in the citations, Google Scholar, Balaji Arumugam name type panni, citations it has crossed more than 200 citations. Just cross, so that credit is very, very important. So similarly, you are also supposed to give the credit to other people, those who are publishing the articles, right? Aravind has asked one more question, sir. In our country, funds are not available. That means, sir, even though we have many ideas, we can't proceed, sir. What is our advice to such students, sir? Yes, this is a very important limitation in our country. So that is why I would suggest you to do a basic research in the beginning. But when you become a renowned or well-known researcher, then only, because see, any funding agency will think about the quality of the research article, what you publish, and quality of the author. Say, for example, you are proposing an article for 2 lakhs or 3 lakhs, right? So, how do you expect a funding agency will give you 3 lakhs immediately for doing a research project? So, it is not possible, right? So, that is the problem in our country. Funds are available, but you should become a notable, renowned, good quality researcher to get funding for publication. But apart from all these things, ICMR STS project is funding 20,000 rupees during the student period itself. In the student period, I never know all these things. I never come across. 1970s, but 1990s, I have completed my MBBS. Okay, right? So I never come across all these things during my undergraduate period. But it is good. ICMR STS is a sponsor project only. 20,000 rupees as a stipend they are giving. That stipend can also be utilized for doing any of your project also. So those things can be done initially. Then that certificate can be utilized for getting funds for future projects. Okay, Arvind? Can you tell something about working and publishing on a research article, sir? Working and publishing on research. See, so far we are discussing about publishing on research article, right? So when you want to publish a research article, so how to proceed, right? So create the publishing article in the form of the text expected by a particular journal. That is the first point, Revan. Revan, listen to me. This is a very important point. When you want to publish in a particular journal, see, every journal has got its own policy, right? Go through the journal page completely, read the entire thing about, especially about the authors, or content, or go through the entire content what is given in about the authors or for authors. So for authors, the guidelines, go through the content guidelines very clearly. Then you start framing your own text, entire text for that particular journal policy or for that particular guidelines. But for the general guidelines is these 5 to 6 points. Write an abstract, introduction, then aims and objectives, materials and methods, results. Discussion is very important for full text. Many students have seen results, discussion miss panniruvanga. Discussion part is very important, and then conclusion 1 or 2 paragraphs, and then reference or bibliography. Okay, right? As a students, if you are doing independent research, what will be the topic, sir? Now, I have told you, please do not do any. As a student, I would not suggest you to do any research independently. Okay, right? Without any guidance and college support. Sir, can a health science graduate do PhD after graduation? Yeah, definitely, you can do. Till now, I'm having an idea. Even after MD, I'm thinking of doing a PhD. MBBS you can do PhD. Health science, any health science with master degree, postgraduate degree can apply for PhD after graduation, right? Any other questions, my dear students? I think we have discussed about ICMR STS project, basic steps in research. We have started with basic steps in research process and statistical tests of significance. What are the statistical tests? What are parametric tests? What are non-parametric tests? We have discussed, and then the skeleton about your publication of publication of the research article. One more question. Can we do research on public spreading fake medical information through social media? Yeah, absolutely, Arun, we can do. You can very well do such a topic, but create a strong, validated, pre-tested, pilot-tested questionnaire. Yes, that is important, Arun. You can do the survey. Very, very nice topic. You can do this particular. You can very well do this topic. I would suggest you to. I can also guide you if you want, but provided you should have a strong, good quality, standardized questionnaire. Okay, right? How can we use the given 20K in survey-based studies? Right? See, for survey-based studies, you may not be, see, the fund 20,000 per you may not be in need of spending so much of money. Okay, right? So suppose if you want to do a qualitative research, suppose if you want to do a clinical trial, you will be needing little more. Suppose if you want to do a laboratory investigations, for that you need to spend some money. So for those studies, you will definitely need some money. That 20,000 money can be utilized. But for basic survey you will be using those stationaries uses or you can also utilize it for your transport costs or something like that. Okay, right? Directly after graduation, yeah, MBBS can do MBBS after completing MBBS. You can very well do a PhD in India. Yes. But I strongly feel that after having a master's degree only you can go for a PhD. Okay, not with, but MBBS people can do a PhD directly. But I have seen people trying doing PhD after MD, after MS. Many people. Till now, I have told you, the idea PhD in epidemiology is my actually very important area I want to do. I am not interested in doing questionnaire-based study. I don't feel that it's worth, sir. Many are giving false answers. What else I can do without no funds? Please do not have such an idea. Arvind, I don't feel that it is worth, sir. No. Questionnaire-based studies, all your descriptives, major, large clinical trials and evidence-based studies, all those evidence-based studies, clinical trials and RCTs, they all started from the basic descriptive study, questionnaire-based study only. Okay, right? Of course, there are some people, they will give you the false information. That is also possible. So that is humanly not possible as a researcher, as an investigator, to eradicate the complete error from the patient side or from the responder side. But Aditya, I would suggest you to utilize a direct interview method. Say, for example, if you are sending a Google document. So how far you are sure about the data, whatever that you are getting it back from Google document is 100% true from an individual, right? So that is not possible to ensure actually, but how can we use a given 20,000 in survey-based studies? That just now I told you, 20,000 money in survey-based studies ki nee kandipa use pannalam onnu kedaiyadhu. Whether if it is possible to utilize for any of your transport costs, any of your patients, any other money which is used for stationaries, those things can be utilized. Otherwise, for survey based, only paper print out may not be helping you, right? So 500 to 600 pages for purchasing a software or for getting a laptop or getting a laptop in 20,000 is not possible. Right? So for survey-based questions, for basic things, you can utilize the money. Okay, right? Can PhD be done while doing MBBS even before? No, I think it's not possible. No. So any other questions, my dear students? I think I have almost covered the basics, statistics, how to publish, we have seen. And I was very happy to listen to all of your queries. I'm ready to even answer much more queries also. Sir, can you please tell something about obtaining consent from the participant of the study? Very good, Sujit. I'm glad that you raised this question. Yes, there is an informed consent form, right? Which is available in the ICMR website. ICMR STS website, PDF document, ICMR website. Download that informed consent form. That is also called as participant information sheet. Participant information sheet, including information informed consent, right? So informed consent, you will be given introduction about the topic, what you are going to do, what is the procedure that you are going to do with the patient, and about the investigator, basic investigator or researcher basic information, and about the confidentiality about the data which is being collected, and finally, if the patient is interested in getting the information, whatever that the data is being collected in the research, or if at all he wants to withdraw from the research at any point of time, all those informations will be given in the informed consent, and getting it and inform the consent patient to sign and also an investigator or the researcher also, principal investigator or the researcher also should be signing the informed consent. Suppose if you are collecting the data from less than 15 years or children, you are supposed to get the consent from the parents or from the teachers if at all you are collecting the data from the schools. Okay, right? Is that okay, Sujit? Or any more information that you want about informed consent? What is the procedure to do PhD after MBBS? You are applying in any universities for university, Tamil Nadu University, PhDs. Can just first procedure is to apply for PhD, then you find out the PhD guide and then proceed. Okay, have a good research experience so that you can do PhD. Can we communicate with foreign researchers with same idea, add them as co-authors? Please be very careful, Arvind, when you want to include the foreign authors or foreign collaborative, international collaborative research, right? Either it is a questionnaire-based study or even a simple survey-based study or it is a clinical trial, anything cannot, because our Indian government has got our own guidelines and abroad guidelines where the funding agency, the co-authors quality and the co-authors reputation and everything you are supposed to find out before having an international collaboration with any other researchers. Okay, Arvind? Can you tell us something about open access? Open access na open access is nothing but Google Scholar, any journal which is easily available to all the electronically easily available and accessible to all the readers and authors. That is open access. Okay, right? And whether ICMR will accept the study we propose, how to make an attractive study researcher for them to accept. Right, especially for ICMR STS, this is very important because 10 years and more than 10 years and students in a guide 10 years ICMR STS proposals. So far, I think I have only 6 projects got accepted. Accepted in the sense ICMR proposal level accepted. It went on to the next level for doing the report and doing the study and publishing the report. Right. So ICMR acceptance, especially ICMR STS, big question mark. You cannot question them why it is not selected. The questions are okay, right? So ICMR STS, they have got their own protocols. Either it will be selected or not selected. There is no reason for them to give you the answer why it is being selected and not selected. So attractive study research area, how far it is feasible for you, how far it is interesting to you to do the study. Do not do the research for attractive purpose or attract anybody for acceptance purpose. If they don't accept in ICMR STS, then you can also, who said that you can stop proceeding? You can very well proceed with the project and then publish it in some other journal, right? It's not necessary that ICMR STS accepted panna matunda you can proceed lang kadayadu. ICMR STS accept panna you can proceed with that particular ICMR. Okay, right? Do the publishers ask for the questionnaire and any more material for the publishing, sir? And is a validated questionnaire mandatory for publishing the research paper? Yes, Kanna. Publication pannumbodhu, standardized the questionnaire is important. Many of the journals, they will ask you even the raw data also. Raw data questionnaire kepanga. You have to be very careful. Keep that questionnaire very carefully with you. Can I collect data from other medical colleges by taking permission from any college ethical committee? Yes, you can do. You can collect the data from other medical colleges. You can get the IEC approval and then you can get the data collected from other medical colleges, provided getting the official permission from the head of the institute also. Okay, Janish? Sir, any ideas on Surya has asked a sir, any ideas on how to overcome the responders in complaints in psychological studies when direct interviews are not feasible? Yeah, absolutely. It's a very, very tough area, especially non-complaints in psychological studies when we do direct interviews are not possible. Of course, so there are some areas in those places when then you can admit the questionnaire to the patient's attender. That is the only possible way of getting the questions filled up, provided Those informations are clearly given in the questionnaire itself. These questions are not for the attenders. These questions are for the patients. Okay, right? So this is the only way to avoid a little bit of non-compliance, especially in psychological studies. Okay, but I would suggest you to, especially in psychological studies, already published standardized scales use pannunga, that will be better. Okay, right? If there are no more questions, then we request the participants to kindly fill the feedback form given in the description below. Thank you, Prasanna. Is informed consent is needed for questionnaire-based studies? Anuradha, yes, definitely. Any study, you need an IEC. There is no doubt about it. No doubt about the IEC is needed for simple, descriptive questionnaire-based studies also. No doubt about it. Informed consent, IEC, there is no doubt about it. You are supposed to get the informed consent. Verbal informed consent, now we are supposed to audio taped, video taped informed consent level. So you are supposed to get the written informed consent. Okay? Informed consent is mandatory. Please tell some renowned journal other than ICMR, STS who... See, ICMR, STS is not a journal. ICMR, ICMR is an agency which is supporting the medical students to do a research. ICMR, STS is the journal. Okay, ICMR is conducting a journal which is called as IJMR, which I told you, Indian Journal of Medical Research, right? Please tell some renowned journals. Renowned journals. See, I have told you, choose your topic, and for that particular topic, find out what is the specialty, right? And the particular specialty keep search in the Google or PubMed, find our UGC Catalyst. I would suggest you to find out from UGC Catalyst or PubMed. And the journal, and the journal, then you go to the journal page and then find out whether this journal is an indexed agency or not, right? So that is how we can find out the renowned journal, right? The renowned journal name, I can tell the renowned journal from my specialty. How do I know from microbiology? How do I know from anatomy? Right? I may be having so much of vast research experience, but journal names, see, umpteen number of thousands and thousands of journals are there. So renowned journals is nothing but indexed journals, can be found out from UGC Catalyst. Okay, right? Janani, sir, if we have already graduated, can we approach other institutions for guidance? As you suggest, it is important to do research under again. It's better to have a guide. It's definitely better to get a guide from any other institute. I'm also ready to guide you. So you can also get the guide from nearby place. So not necessarily that guide has to be physically present all the time in your wherever that you are as a resident. You can also get the guide. Say PhD guideline. PhD guideline. Do you think that all the PhD guides are available all the time with them as a resident in that particular town or something? No, it's not like that. So you can get the guide from anybody else, anywhere else, right? Okay. Hope I have answered you the question, right, Janani? Hope if there are any questions, I was so happy and very, very happy and glad. I've discussed with this young generation. It was 1 hour 43 minutes. I was so happy. And if you may be having a lot of doubts, you can get my phone number from your organizing team. And thank you so much for the organizing team, IMA, Tamil Nadu, MSN Network, Prasanna, and also Venkatesh for giving me this opportunity. If there are any questions, we'll wind up the session. Yeah, I'm getting one more question from Arvind. How to publish a journal without no funds? Without support from guide. How to publish a journal without no funds, right? So funds can be obtained either from your college where you study, if possible, from your management, right? Or the next possible thing is the publication charges can be shared by all the co-authors. This is the only thing which can be done if at all you don't have any funding agency to support your publications, right? Sir, are there any other options similar to ICM or STS by other organizations? As of now, national level support pandra biggest organization is ICM or STS only. Many other organizations are there, which I will be telling you later on. But ipodike, I would suggest to medical graduate ICM or STS mattum pannunga, Kishore, which is very useful, Kishore, because an ICM certificate that is very important. Even if you do it from some other organization, or national level renowned organization, ICM is a nodal center at the national level, right? When you get a certificate from ICMR doing an STS project, that will be more valid instead of doing any other projects from any other organization. But I will let you know the organization later. I mean, yeah, professors are too busy. Yeah, I'm very busy. I'm very, very busy. These are all the, see, please ask any questions related to scientific or research related, publication related questions. All those logistics questions I cannot answer, Arvind. I'm so sorry. Thank you, Rohini. Thank you so much. Thank you all. It was highly useful session, sir. Thank you, Sujit. Any more questions? Okay. Do the research with great confidence. Try to select the nice questionnaire. Talk to your guide. Talk to all your senior faculties. Choose your topic. Choose a wise topic. Do a basic research for 1 or 2 months and get an experience of doing research. Okay, right? Thank you so much. Aravind is asking another question. If an Indian MBBS student dream to get Nobel Prize, what is your advice? Aravind, these are all out of questions, right? These are all not related to our journal publication, research, biostatistics research methodology, right? Nobel Prize ko. Nobel Prize apply pannira matana. This is a nice question anyway. Okay. So thank you so much. I'm going to end the stream. Once again, I thank the organizing team for giving me this opportunity. Okay. Bye bye, guys.